presentation is for Dr. Rema Hadi. She is a plastic and cosmetic surgeon. She works in Swan Clinic and Carina Private Hospital. She is also working in medical council and medical laboratory. Can you come here?
Thank you. Okay, thank you so much everyone for being here, for surviving the day. Thank you to the organizers. I know organizing this is not easy. It's been actually a lovely day. Your faces are all beautiful. And I hope I see you all, but not in the medical council. So why am I here? So I finished plastic surgery training 10 years ago. I did general surgical training and I did some vascular. And after 10 years of private practice, I started doing some work with the medical council, the tribunal, and I enrolled in a law degree because I'm bored and it's a midlife crisis. Thank you to my poor husband for putting up with me. So what I want to do today is talk to you, first of all, how do you identify problem patients? How do you treat patients carefully? How do you prevent complications, both physical and mental? And how do you deal with complaints? My colleague, Dr. Ola, will talk more about screening, but essentially, if you have the privilege of screening for the patients beforehand, the GP referrals are amazing. Sometimes, however, they slip through and we're all stuck with them. So this is about how do you deal with them once it's happened. The screening tools are multiple if you get the chance to do so. I think anybody who wants any procedure should go through this. I don't think it should just be us. APRA changed the rules 3 years ago. I'm so happy. Now I can say, I'm really sorry, I can't operate on you. You need to see a psychologist or psychiatrist. I thought there was only borderline. However, it turns out you can have lots of personalities. All of them are very multiple colors, and all of them make it very difficult for us to treat. They challenge us on multiple ways. It makes it very difficult to treat them. They don't cooperate, they don't listen to instructions, and it feels like we're not on the same team. I did a course with the Blue Knot Foundation, actually dragged my staff and my nurses there. It was really helpful. Basically, it taught us to treat everybody as if they've been through trauma. And I'm not talking about general surgical bleeding trauma, I'm talking about psychological trauma. So essentially, in a nutshell, skill sets that are not naturally innate to surgeons, which is treat everybody kindly, be gentle with everybody, explain what's about to happen, give them a chance to ask questions, make sure the paperwork's done properly. Again, College of Surgeons taught us how to operate, did not teach us how to treat patients from a gentle perspective. And I think moving forward, this generation, I look at my kids, I look at my sister-in-law, this is what they expect. It's not just about the medical, you got it right medically, but it's about the other part of it, which I guess is customer service, you could call it. It's about looking after it. So, and everybody, all of us, if you're seeing patients, we're all going to be in contact with this. The other thing I think is really interesting about this is I thought there was only flight and fright, but now we know that there's also freeze. Freeze is a problem because I used to do procedures under local. If the patient freezes and they're going through trauma, how do I know? Because they're not saying anything. So gradually I've changed more and more to doing things under general or sedation. If I do things under local, and my advice to everybody who does, including our colleagues, the radiologists, you really need to be careful. Have someone with them. Are you okay? Are you okay? Can I proceed? Otherwise, you're in danger of, I'm traumatized by the procedure mentally, and that has kind of serious medical legal implications later. Even if you've given consent, you have to keep checking on them. Patients who have been through mental health trauma, and I guess in context, a lot of us have been through war. War is trauma. Immigration is trauma. Loss of family, loss of income, loss of resources. That's all trauma. So all of our patients from our community innately probably have been traumatized. And I think we have to be especially kind to them, especially gentle to them. Whenever I see a patient of a similar background, I always think, oh my gosh, yeah, I know what you've been through in one way or another. So a lot of those patients, sometimes everything's going well, they react in anger, avoidance, they don't answer the phone. How many times do I have to call you to check on you? Dissociate, they self-harm, drugs and alcohol. And you think our community doesn't have drugs and alcohol? There's a lot of drugs, both prescribed and non-prescribed. So before doing anything, embarking on any treatment, I always try and understand what the patient wants. I try and build trust and rapport, God knows. We try to have shared decision making. We try and manage unrealistic expectations. I always try and see them more if I think that they didn't understand. I'm not going to go through all this, other than to say I now have a diagram. I draw on the diagram exactly what happens, and I make the patient sign it, and I give them a copy. Because I think the biggest danger is when people are in that mental health phase, they don't listen, they don't hear what we say. At least I can go back, remember we said this? Our consent form used to be a piece of paper with one line. I would consent to this. Now it's war and peace. This could happen, this could happen. They have to sign every single page and return it and keep a copy. And it's sad that it's like this, but I think this is the world we live in. Again, I'm going to skip through this, other than to say, I think our community is overrepresented with the medical council because I think we are gutsy people who do things that are slightly out of the square box. I think consent's really important. Make sure that you have the paperwork that matches what you're going to do. Make sure the patient's carefully consented. If a patient is not happy, I always get the nurses on board. I try and have a family conference. We talk about what happened, try and understand what occurred. And sometimes there is no complication. It's a mental health issue. But I think it's important also to get the backing of your colleagues and know when to refer. So apparently we're supposed to have a complaints policy in the clinic. This is something new to me. So explain what happened, document it, ask them to send you the complaint. If they complain to you, it's less likely they're going to complain to someone else. Have someone in your clinic, like a practice manager or a nurse, to deal with it, because it sounds like you escalated it. If you deal with it, then nobody else has to deal with it. How do patients adversely react? They can give you a bad review on Google, RealSelf, or RateMD. It's very painful. It's very, very painful because it's often one-sided. If you answer back, don't take it personally. Ideally, have a generic reply that's pre-written. If you know who it is, you can email them and take the discussion off the forum. Don't breach the patient privacy, because so far nothing's happened. If you breach the patient privacy, it's misconduct or unsatisfactory professional conduct. You can go down the defamation route, but I don't think it's really ever worked. If you end up with, God forbid, an APRA HCCC complaint, remember, most complaints don't proceed anywhere. Really, APRA knows that this is just a method of the patient escalating or bringing up an issue. If it does, get your medical defense to help you write a response. Sometimes the HCCC and the medical board will refer to the medical board or medical council, which is how I get involved. Worst case scenario, then it goes to the tribunal. Essentially, the advice is be honest. They call it candor in legal terms. Don't obstruct the investigation. That itself is professional misconduct. If you get a medical legal letter, so separate from that complaint, sometimes, again, it's often fact-finding. If you have good notes, you respond back. Lawyers are less likely to be interested. Get your medical defense to check it before you reply. As I mentioned, just make sure you have thorough consent. And usually the medical defense will just pay the patient to go away because they don't want to avoid the cost of litigation, even if you've done nothing wrong. So remember, 99% of patients are happy. It's the 1%, I guess, that end up, I see them later. If you need any advice or support, I'm happy to help, just from a very little legal background that I have. But remember, like, everyone's doing a really good job, everyone's trying really hard. It's not you, it's them. But at the same time, try and put in things in your practice that help prevent these problems. Thank you very much.